I am incredibly grateful for our next conversation because we are coming together at a moment where there is both kind of enormous reason for optimism about the fight against HIV and AIDS, and also deeply concerning and less than encouraging news in the ongoing effort to end AIDS. The good news stems from a recent report from UNAIDS that we can end new HIV infections and the public health emergency that has been AIDS for more than 3 decades if we stay the course by 2030. This is only possible as a promise because of the extraordinary work of activists, of advocates, of scientists, of grassroots organizers, of doctors, of nurses, of midwives, of many of you here in this room over the many decades of HIV and AIDS. It is particularly meaningful to us here at the Clinton Foundation to be on this precipice because the origin of the foundation really began in 2002 when my father and Nelson Mandela at the Barcelona AIDS conference that year decided to do something about the deep inequity that existed in access to HIV/AIDS treatment. People here in the United States were more likely to have access, although still far too few did. But people living in South Africa and in much of the global South had no effective access to the medicines that were able to turn AIDS into a chronic, livable illness. Because that cost of treating a person per year more than 20 years ago was $10,000. And so my father launched the Clinton HIV/AIDS Initiative, now CHI, to turn what had been a high-price, low-volume market into a high-volume, low-price market. And today, the average cost of treating a person per year in the global South is less than $60. So I am incredibly proud of this work and proud that my father and the many thousands of extraordinary people who have worked at CHI and continue to work at CHI kind of have taken that as only a reason to keep going to do more. And so CHI has negotiated more than 140 different commodities arrangements enabling earlier detection, treatment, and when possible, vaccination against a number of the health scourges that still take far too many lives of far too many people around the world. And we know that while the end of AIDS being in sight is an incredible testament to the work of everyone over the last 30 plus years to get us at this point, as we heard earlier in the conversation about protecting HIV/AIDS rights, we cannot take our foot off the pedal, and we cannot mistake progress for success, and we cannot take for granted that everyone will recognize the importance of this fight for justice, equity, and health. Because while certainly we are very proud at CHI for all the work that we've been able to be part of, to pioneer, to stand behind, to learn from, we know that much of our work, as much of the work of any of us in this room who have been engaged in this fight, has been made possible by the work of the Global Fund to fight AIDS, tuberculosis, and malaria, by UNAIDS, by the World Health Organization, by UNICEF, by many of those who have been at the large global multilateral institutions, many of whom in turn have received support from PEPFAR, the US President's Emergency Plan for AIDS Relief that President Bush launched in 2003. It is the single largest effort ever undertaken against a single disease in history. And it is one that for much of its 2-decade existence has received, even recently, strong bipartisan support here in the United States. And yet today, reauthorization for PEPFAR is not something that we can take for granted. And without the continued support of the United States government and effectively of citizens here in the United States, we will not be able to turn AIDS into part of our history instead of still such a stranglehold of our present and a shadow for our future. So while the UNAIDS report suggests that the data is robust and strong and that we can end AIDS as a public health crisis and end new HIV infections by 2030, that is only possible if we sustain political will and funding and focus it on where the virus continues to spread most rapidly. And at the moment, that is among women and children. A staggering 84,000 kids around the world still die from AIDS every year. And so for those of us who care about children, for those of us who care about equity, for those of us who care about justice, for those of us who care about public health, we have to care about the fight for PEPFAR reauthorization. And yet we know that's still only one critical step in reaching the milestone that UNAIDS tells us is possible. And we know once we reach that milestone, we have to continue to provide support so that everyone living with HIV and AIDS is able to live lives full of dignity, promise, purpose, and hopefully then die of something else at 100. Because if 100 is the milestone that we're also all marching toward, everyone who lives with HIV and AIDS deserves to reach that milestone too. And so I just hope that if you didn't know what PEPFAR was 3 minutes ago, you do now. I hope that even if you think AIDS isn't your issue and kids is, you now care about this. And I hope that at least some of you and all of the Americans in this room make sure that your elected representatives know why this is important to you and why it is clearly so evidently, I hope now, important to all of us. And so with that, it is my incredible honor to introduce someone who knows quite a bit about the effort to put AIDS in the rearview mirror, Winnie Byanyima, who is the executive director of UNAIDS and has dedicated her life to helping to advance issues that relate to women and children's rights, health, safety, equity, and equality for all of us. She is someone I have long admired, and I am quite giddy that I get to monopolize the next 16 minutes of her time to learn from her about what she thinks all of us need to know about the fight to end AIDS as it relates to both this global public health crisis and anything and everything else that we all care about. Please join me in giving Winnie a very, very warm welcome to the stage. Winnie, thank you so much. So Winnie, thank you so much for being here. And I hope that we could start with you kind of sharing with the audience kind of why there is optimism from UNAIDS perspective. Kind of what is it that you see kind of in the data that compelled you to put a stake in the ground to say, you know, if we stay the course, we can end new HIV infections by 2030?
Thank you, Chelsea. And thank you for inviting me here to be with you. Thank the Clinton Global Initiative for making this an important issue, because today there are so many crises in the world that it is dropping off the agenda. But there are 3 reasons why it shouldn't. One, it's because AIDS is not over. The fight is not over. You've spoken so well about it. We've got 30 million people on treatment globally, living healthy lives, but we've got another 9 million people living with HIV who are not on treatment. We must reach them. So AIDS is not over. But secondly, because we know how to end AIDS. We know we have a clear means of how to do it, even though there's no cure and no vaccine. We've got tools in between to get everyone, first to prevent infections, new infections, and to get everyone on treatment if they are. So we have the means, but we lack the will. So the third reason why we must keep this alive on the agenda is that it's a smart investment to fight HIV/AIDS. When you fight HIV/AIDS, the things you do to fight HIV/AIDS also contribute to achieving the other Sustainable Development Goals. Secondly, fighting HIV/AIDS is prevention. When you're preventing HIV infections, you're also preventing, those same things prevent other pandemics and give capacity to be prepared for any future ones. So it's a smart investment. These things are being discussed here at the UNGA, but often disconnected from HIV/AIDS. So those are the reasons. So then we've come a long way and we know how to do it. Like I said, like you said, the world came together at the height of this disease. This didn't happen with COVID. The world came together, agreed to fight together, made commitments and clear targets that are renewed every 5 years. Heads of state come here every 5 years and make a new declaration, set new targets, and work together globally. Leaders rose like your father, like President Bush, and after that global consensus came with this PEPFAR contribution, injecting financing capacities in the developing world where it was weaker and where the burden was highest. So PEPFAR came, Global Fund came, and then people themselves fought, and again leaders rose and prices came down, and everyone could have this life-saving pill. So we need to repeat those successes. And thank you for bringing us here to do that, to remind people that 30 years ago, the world came together, 40 years ago, and that now we've achieved so much. We've got 30 million people living good lives. We have another 9 million to bring to treatment, and we've got children who are dying. Children who are dying because the gap between them and adults on reaching treatment is so wide. We can't reach them. We need to reach them. So the job is not done.
Winnie, reflecting, listening to you, how much of a challenge do you think kind of the success of the last kind of 40 years when the world first really came together at the first International AIDS Conference, kind of set a set of goals, kind of more countries, kind of more science, more activists kind of came to every conference, that we had the birth of the Global Fund, kind of PEPFAR, that so many people who may not be as close to this as you or I think, well, so much has happened, it's now time to focus on something else. Right? Look, wow, 30 million people are on treatment instead of, I think, what you and I believe, well, then we have to get the 9 million more people on treatment. We have to prevent every kind of new infection, whether kind of mother to child, kind of sexual transmission, like everyone deserves to be able to have the tools to keep themselves safe and healthy. Other people may focus, well, look at the 30 million people on treatment. Doesn't that mean we can do less? How do you respond to that?
Well, every life counts. And when you look at who is not getting what they need to protect themselves or to get on treatment and live well, it's a sad story. These 9 million people are not 9 million who need to get on treatment, but there's also 1.3 million people newly infected every year as well. So when you look at who is at risk and who is not on treatment, it's a sad story about who we are as a world.
And who we value.
Who we value, because indeed, the majority of new infections in the world today are women and girls in Africa. Poor countries, poor women and girls. The majority of people who, or the group that is also most at risk and doesn't get access to treatment are LGBTQ people, transgender women, gay men, and often those in the categories of poor as well. So a combination of access of inequality, poverty, race, gender, even disability, work against people and put them at more risk, not only to get infected, but also less opportunity to get what they need to get on treatment. So it is it's a disease of injustice. It is not, it is injustice, it is inequality that drives this. But we know that when you start to close the gaps on rights, when you ensure everybody has equal rights, when you allow civil society, communities to engage, to lead, when you can use the data sharply to target who needs prevention and who needs treatment, you start to see progress. But all lives matter. We can't say we've done 30 million, let the 9 million die. We cannot say that. So all lives matter, and children, LGBTQ people, girls and women, especially in Africa, are most at risk. We're failing them.
We are certainly failing them, and yet we are more likely to be able to reach more people in more places if we have both PEPFAR reauthorization and also continued global commitment and leadership from a lot of the people who are across town at UNGA. And so I wonder, kind of, Winnie, as you have been kind of so deeply in this work, what you have found kind of are the arguments that work to help those that we need on our side to keep going?
Yeah. Well, first there are I could identify 5 key elements of making progress, how we've gotten here. One, it is the strong political leadership you're mentioning. The people across on the east side, we have to mobilize them. From the national level to the global level, we need strong political leadership. It's failing now. We are in a world where the geopolitics have gone crazy. And it's even hard to get leaders to stay committed to what they committed long ago. So building that trust and political leadership is key here. We need to follow the science, as I said, to address the real epidemic in each country, not the epidemic they want to think they have, but to follow the science, the evidence, to close the inequalities for those people most at risk in Africa, women and girls, gay men, and transgender women particularly. We have to let communities lead. That is key. Communities must lead, because actually HIV has transformed global health in this way. By communities coming in, gay groups, women's groups, serving themselves, they serve themselves in dignity. They reach everyone. They reach those who would never be reached. So letting communities lead, but we are seeing civic space shrinking. So we have to fight for that. And fifth, financing. Financing is waning. It's dropping. It's dropping because of geopolitical tensions. It's dropping because of other challenges that have also to be financed, but we have to keep the financing that has been there. So what do we say to them? We say, you're almost there. Look, today we have 5 countries with the highest burden who have already hit the targets for 2025. Botswana, a small country called Eswatini. I wonder whether you know it. It's a little island in the middle of South Africa, but has hit the targets. It's Rwanda, it's Tanzania. These are Botswana. These are countries that have already met the midway target of 2025. Another 16 are almost there. So we're close. Why drop the ball when you are winning? So this is the argument we want to give them. And that when you do it, you also solve other problems. But we have real challenges, Chelsea. This pushback on rights is terrible. I come from Uganda. I think you've heard the story there, that there was a horrible law that was enacted, Anti-Homosexuality Act. But look, what inspires me is that I was there last week, and activists, women and men living with HIV, gay men, have come together, gone to the government and said, okay, you've made that law, we hate it, it's against our lives, but can we help you to explain to security officials, to health officials, to minimize the harm. Can you imagine? They are working with the minister in charge of security to sensitize police, soldiers about how not to do more harm. This is, for me, tells you that we must not give up. If they are there fighting, we can't.
And I mean, Winnie, we see kind of so much of what has made the progress of the last, particularly a couple of decades against HIV and AIDS, possible under attack. You know, kind of what you mentioned about kind of new laws and places, including in this country. The kind of efforts to kind of retrench funding, the ongoing kind of deep structural vulnerability of kind of girls and women and kind of members of the LGBTQ+ community around the world. And yet we also do have moments, I think, of compelling optimism. The activists that you met last week in Uganda, many of the people here in this room, you yourself, who are kind of admonitions to keep going. And I wonder, you know, if in our closing couple of minutes, kind of you could share any reflections you have from your time at UNAIDS that could be relevant to people who hopefully, you know, care about this, but their central kind of compulsion is climate change or girls' rights broadly or education. Kind of what do you think you've learned that could be relevant to anyone as they think about the need to keep going?
Okay, before I get there, let me inject myself in your politics.
Please, inject away, Winnie, you're always welcome.
Yes, I'm going to say to American congressmen and women and senators, please authorize PEPFAR, reauthorize PEPFAR. We need it. We need it. We are here because of the leadership of America, of the generosity of American people, putting these billions into the response. Look, in the high-burden countries, which are in Africa, in many of them, up to 95% of the funding for this, putting people on treatment and prevention, is paid for by this program. And these are countries today that are so highly indebted, they are paying towards servicing their debt, just the interest on their debt, 4-5 times as much as they are putting in their whole health systems, leave alone the bit on HIV. So, this is not the time this is the time for the leadership in America to continue doing what it has done right and continue supporting countries to keep their people alive. It is so important. It's been a great part of the success story. 25 million people on treatment today have been supported by the PEPFAR program. So we need it. Now, you say your question was, so I am hopeful. I am hopeful that PEPFAR will be reauthorized because people I know are alive today because this support is there. And it's more needed today than ever before. Your question was? I've forgotten it.
Well, I think maybe you answered it, right? To just have singular, unrelenting focus and to inject yourself in any room or conversation where you need to be to ensure that you can meet your objectives.
Exactly.
And that's really ultimately good for all of us because the return on investment for Americans with PEPFAR has been extraordinary. More than 25 million people are on treatment. What has happened with kind of the number of kids who are then able to go to school, parents who are able to work, kind of sustainable agricultural practices that can be put kind of into motion. Again, anything that may have brought you into this room is related to PEPFAR reauthorization. So at the risk of belaboring, please, to the Americans, call your representatives, and please, to all of you, give Winnie a huge amount of gratitude and appreciation for her time today.